Good day once again to all our listeners and viewers. Welcome once again to our COVID-19 Information Command Center here at the studios of GIS. It has been quite an eventful day here for us at the Command Center. Earlier on today, those of you who have tuned into us, we gave out quite a bit of information with regards to what is happening in various sectors, in the health sector, with regards to policing, our nurses, with regards to agriculture. And as you are aware, today, Tuesday, April 7th, 2020, the 24-hour curfew was relaxed somewhat to allow persons the opportunity to purchase items of food, medication, petrol, cooking gas, banking, and a few other scaled-down services as noted by the government. This new curfew will be from 7 p.m. to 5 a.m., and it will be for the following days. Today, Tuesday, April 7th, tomorrow, Wednesday, April 8th, on Thursday, April 9th, Friday, April 10th is Good Friday, so the 24-hour curfew goes back into effect. Then on Saturday, the curfew is lifted once again between the hours of 7 p.m. to 5 a.m., and the same happens on Monday. We go back into the 24-hour curfew. As I noted, the supermarkets and a number of the shops were open today. And despite the fact that, persons were asked to adhere to the various protocols, 2 persons being allowed per family to the supermarkets, 2 persons per vehicle, we did witness a number of persons not adhering, not sticking to those protocols. We have some amateur video footage. I'm sure several of you who have been on social media would have seen some of those images and expressing some of your disappointments that persons were not adhering to the protocols, staying 6 feet away from each other. In some cases, in many cases, persons were wearing their masks, but in some instances, we did observe persons who were not wearing their mask. And as such, we were sent some information by the Bureau of Health Information and Education in terms of asking persons to adhere to the correct protocols when it comes to wearing your mask. And here are some key action points that we need to highlight with regards to wearing of the mask. Your hands should be sanitized before putting on a mask. When using masks in public settings, we should still be adhering to social distance protocols and maintain 6 feet distance from the person next to you. Ensure when wearing a mask that you do not take it off, for example, to speak or to eat, and put it back on. This can cause cross-infection or cross-contamination. Do not touch your eyes, nose, or mouth when removing the face covering, and wash your hands immediately after removing. Do not place cloth face coverings on children under the age of 2, anyone who has trouble breathing. If one has a homemade mask as the only option for covering, decide to wear a homemade mask as the only option. They should be properly cleaned before they are first used and for every reuse. These should be washed with a bleach solution or, if not possible, soap and water. Do not place used mask on your counter. For example, what I've done here, do not place your used mask down on a counter or chairs or around the house. Rather, put them to wash immediately to reduce the risk of transmitting the virus to other items in the home. So if you're using a mask like what I have here, it is advised that you do not touch the surface of the mask, and as best as possible, use your fingers to hold the clips that goes around the ear to put the mask on. And what we witnessed today, we were seeing persons putting their mask, for example, on the top of their heads, and they're sweating and then putting it back onto their face. What you're doing is causing more cross-contamination. And of course, if you have masks that are reusable, as soon as you get home, it is advised that you sanitize this mask, wash them properly. If you have a disposable mask, of course, you dispose of those masks as soon as you get home. We also note that in several instances today, for example, at Massey Waterfront and some of the other supermarkets, the banks and stores, persons were not adhering to the social distancing protocol. We saw persons bunching up and bundling up, and this is cause for concern. We have a report here from the Ministry of Health with regards to social distancing and the proper protocols.
Social distancing has proven a challenge for many members of the public, despite the very real threat of contracting a deadly virus. Since the outbreak of COVID-19 and the declared state of emergency, many joined cramped queues at banks, crowded supermarkets, and continued to socialize in public spaces. The Environmental Health Department is admonishing the public to obey the law and practice social distancing at this time. Physical distancing protocols of the Emergency Powers Act orders services, government agencies, and essential services to ensure that all customers and staff maintain physical distancing of no less than 6 feet in the business or office, or outside the business or office. It also orders such entities to, if required, determine the number of persons that may be permitted in the office at any one time by permitting one person for every 30 square feet of space.
We have observed that in practice, the recommended 6 feet distance is not being maintained, especially when persons queue for service at institutions and business places such as supermarkets, banks, etc. To this end, we wish to implore the public to adhere to those measures. By maintaining the recommended 6 feet distance, you reduce the likelihood of getting infected or spreading the virus when people around you may cough, sneeze, or make physical contact.
She further advises that persons make limited trips to the supermarket and other places of business and avoid getting together in groups. Instances of breached containment efforts in the public domain forced the hand of the Prime Minister to announce tighter restrictions on Sunday. He chided offenders during the press conference.
We have not done a good job of making sure that we're all doing the right things. I mean, the government has made the resources, has put all of the laws in place, has increased the number of policemen out in the field, but many of us have just refused to adhere. There's still examples of people going to bars. There's still examples of people going in crowds to the beaches. There are many operations that have continued to operate flaunting what was required by the government. So this afternoon I have to announce that we are going to have to put more stringent regulations in place.
In the briefing to announce the 5 new cases of COVID-19, Prime Minister Chasney announced an extension of the partial scale-down of non-essential economic and social activities to April 14th, an extension of the curfew now from 8 p.m. to 5 a.m., and the suspension of liquor licenses island-wide. For the Government Information Service, I am Jessie Leonce. Social distancing has proven a challenge for many members of the public, despite the
Social distancing, it is the new norm, and staying at home is the other new norm if we are to make any dent in our fight against this global pandemic, COVID-19. So just to reiterate and to go over some of the protocols, the curfew is back in effect from 7 p.m. this evening until 5 a.m. tomorrow morning. When out in public tomorrow, ensure that you wear a mask. All persons are required to wear a mask. Practice social distancing in and outside of shops and places of business like the banks, and only shuttles to and from community shops are allowed. Only 2 persons will be allowed in a vehicle within the zones where they live. Purchase at your nearest community shops. And we want to reinforce that point here because Again, we see persons gravitating towards the larger supermarkets, while in many communities, there are mini-marts and smaller shops. And we're encouraging persons to patronize these establishments. And we're also reminding the general public that these shops are to remain open tomorrow, Wednesday, on Thursday, and on Saturday. So there's no need to rush out with everyone rushing out all at once today to get everything, thinking that the stores or the shops are going to be closed tomorrow, Wednesday, and Thursday. They will remain open within that period up until, I guess, 6:30 or just before the curfew time of 7 p.m. Self-quarantine, we must also remind the general public, is a measure that remains in effect. So we're encouraging persons as much as possible, if you must be out there to get your supplies or your necessities, get them and remain at home and get back at home as quickly as possible. The lifting of this curfew temporarily is not so that persons could engage in social activities like going to the beach, going to the rivers, going to the parks, hanging out in the streets, and having fun. This is not the reason. The reason was so that folks could stock up or get back some of the supplies that they may have run out of over the last 6 days. So again, we are recommending that you use a mask when out in public, and these guidelines are there for your own safety as well as for the safety of others. We turn our attention now to World Health Day, which incidentally is being observed today, April the 7th. World Health Day is a global health awareness day celebrated each year on April the 7th by the World Health Organization. This year, the observance celebrates our nurses and our midwives. And it could not have happened at a more opportune time as we see our frontline soldiers, as I would like to refer to them, our nurses, our doctors, and our healthcare workers, being at the forefront of this global pandemic. And here in Saint Lucia, we have observed our nurses taking charge. We saw them coming to the fore last week during the transition from Victoria Hospital to the OKEU Hospital. And at this moment, at this point in time, we'll take in a message from Toni Nicholas. She is the Chief Nursing Officer, and she has a message on World Health Day.
Today, Tuesday, 7th April 2020, is celebrated as World Health Day using the tagline, Support Nurses and Midwives. We use this platform to celebrate the work of nurses and midwives and remind persons of the critical role that we play in keeping the world healthy. Today, we honor the contribution of nurses and take this opportunity to highlight the work of nurses and celebrate this profession as one of the most valuable resources in this country. The region of the Americas has about 9 million nurses. 87% of them are women. Nurses and midwives account for more than 50% of the health workforce and are essential to the delivery of health services at the first level of care. Prior to this unforeseen pandemic, the World Health Organization designated the year 2020 as the Year of the Nurse and Midwife. 3 months ago, if someone had asked me what the Year of the Nurse meant to me, I would have answered then, it means a year to celebrate the achievements and transformation of the profession over the last 200 years. But COVID-19 has brought a new meaning to this year. It now signifies survival, unity, teamwork, and strength. And it seems our medical vocabularies have been reduced to flu-like symptoms, travel history, personal protective equipment, isolation, quarantine, and contact tracing. The high rate of infections and death among nurses and other healthcare providers globally is a serious concern. However, our nurses continue to sacrifice their health in the battle to combat COVID-19. Nurses and other healthcare workers are at the front line of the COVID-19 response, providing care, treatment, contact tracing, and leading community dialogue to address fears and questions. Nurses and midwives have a special relationship with their patients that is based on trust. They know the culture of the communities, making them indispensable during an outbreak or emergency such as this one. As nurses, we are all called to service, and we have an obligation to administer care to those in need, even in an outbreak. However, over the last 2 months, I have never witnessed teamwork so powerful. In more recent weeks, nurses led the move from the Victoria Hospital to Owen King European Union Hospital, and we transformed 3 hotels into quarantine sites in one day with 24-hour operations. At that very same time, Victoria Hospital was being transformed from a respiratory clinic, and yet nurses were also in the communities trying to get every possible contact of positive cases to protect the public. I watched co-workers, colleagues, and teammates demonstrate more compassion and dedication than I'd ever seen in my professional life. But most importantly, I observed the ultimate commitment and bravery to face the unknown, risking their own lives to save others, putting aside their own fears and insecurities. They inspire all of us with their heroic dedication and sacrifice. And so, today and moving forward, I call on all St. Lucians to show some appreciation and gratitude to those who continue to fight this COVID war on the front line. There are nurses that you know, perhaps they are caring for you now, or perhaps they may have cared for you in the past. Let us applaud them, pray for them, encourage them, give them some words of motivation, show some sort of appreciation and thank them in whatever means you choose, with the hope that this sincere gratitude will translate into the tangible support they require and deserve. Also, please protect us by protecting yourselves. Please adhere to the guidelines that have been shared from the Ministry of Health. Practice good hand hygiene, maintain social distancing, and remain indoors. Our nurses are depending on you to do what is expected of you so that together we can conquer this war. Thank you.
To our Chief Nursing Officer, Toni Nicholas, for that message on World Health Day, as we salute all of our nurses and our healthcare workers, our midwives, all across Saint Lucia for doing a tremendous job. We are well aware you're under tremendous pressure, and we thank you for your service. And just to also note to the public that we have been in receipt of information from the Water and Sewage Authority with regards to the water situation in St. Lucia. And just a reminder that dry conditions continue at this time, and the prediction for this weather pattern has been forecasted well into 2020 by weather experts. This has continued to deplete our raw water system, our raw water supply, from the traditional abstraction points within the river systems, as well as the John Compton Reservoir. As a result of this dry spell, WASCO is currently considering a number of options to ensure that the available water supply is distributed to all customers. Consideration under review include the extension of a valving schedule which has already been implemented in some communities. WASCO also urges customers to immediately implement the following measures: Repair all noticeable water leaks within the home and or premises. Install or replace defective ball valves in your toilet tanks. To conserve water, it is advisable to stop using a hose for the washing of vehicles and bicycles. Stop watering lawns. Shut taps while using soap on your body or shaving or brushing teeth. Shut taps while washing dishes or clothes. Harvest rainwater whenever possible for household use and watering plants. Use water-saving devices on the taps or hoses at home. WASCO is mindful of the increased demand for water at this time as the country seeks to stem the spread of COVID-19 through the mandated health protocol of frequently washing of hands, clothing, etc., and of course, social distancing. WASCO seeks the full cooperation of the public to the foregoing as it strives to manage the supply of available water to serve every community. The Board of Directors, management, and staff of WASCO wishes to extend our thoughts and prayers to all of our clients, government, and people of Saint Lucia as preemptive measures are taken to curtail the spread of COVID-19. And this has been our message at our command center here at the studios of GIS, that it takes the entire nation, every single one of us, to play our part when it comes to curtailing the spread of COVID-19. Take heed to the official messages, practice the protocols that have been recommended, including washing of your hands frequently with soap, use of hand sanitizer, and we cannot stress enough, going into another day where shops and certain business houses will be open tomorrow. We continue to stress social distancing when you're in public. Do not bunch up with 5, 6, 7, 8, 9, 10 persons in a group as we saw happening today. Do not leave your homes if you're not going out to get your supplies. Stay at home as much as possible. If you must be out to go to the supermarket, get your items and return to your home as soon as possible. Remember that only 2 persons are allowed in private vehicles, and the police will be out in full force tomorrow to ensure that all of these protocols will be adhered to. Again, we want to remind that today is World Health Day, so what a better day to continue to practice best health practices as we continue to wish our nurses and our frontline nurses, midwives, doctors, all the best, and we continue to wish them well. And we end with, on this note, with a World Health Day status as we celebrate our nurses in Saint Lucia. Thank you for joining us once again at our command center here at GIS.